Hi there and welcome back. Today we're going to talk about formulating research questions, a very important topic for several reasons. One is, from a practical perspective, you're going to be asked to formulate a research question and design a research protocol to evaluate hypotheses developed from that question. And that's going to help you how to get engaged in a research project. The second reason, which is a lot broader than that, is to give you an appreciation of the types of systematic thinking that go into developing an evaluation or a study of a program or an intervention. And formulating research questions is a skill that requires attention at a number of different levels. So to begin, how do you develop a good research question? First, you begin by identifying the broad subject area that you're interested in. And take as an example whether or not web-based self-help is effective for people with alcohol problems. We know that electronic measures have been useful in educating patients. We know that many people who have alcohol problems don't have the money to go to a therapist or a residential program. Quite possibly, they might be helped by going to the internet and engaging in a self-help program that teaches them how to control their drinking. But you got to find out first whether the research has already been done on that subject, and if it has, does it answer the question in an appropriate way? So you need to find out what areas have been investigated, and is there a particular question that may have been investigated, but one that's worth extending. You've seen from prior lectures by Kate Robena how to conduct a literature review. And these skills will be useful in helping you to formulate your research question. The next thing you have to do is narrow the topic by asking how and why questions. Often students start with a general idea of what they want to do, and they call it looking at something. So they say they want to look at self-help, or they want to look at 12-step programs, or they want to look at cognitive behavioral therapy, or they want to look at residential programs like therapeutic communities. So looking at something is only a very vague way of getting started. What you need to do is go beyond just looking at a general area. You need to ask questions about how has the research been done and why has it been done in order to answer what questions. So you need to create a list of potential questions for consideration and then narrow it down to the ones not only that you're interested in, but the questions that might be useful to the field of addiction treatment in general. Finally, you need to evaluate the question using the following guidelines. Is the research of potential interest both to the researcher and to others? If it's only interesting to you, that might be okay, but you really want to do something that might be practical and help advance the field. Secondly, is it a new problem or one that's already been evaluated but really needs to be approached in a different way, like with a different population? It may be that a screening test or an intervention has been effective with adults, and now you want to apply it to women with drinking problems during pregnancy, or you want to apply it to adolescents. Third question is it feasible within the available time and resources that you have? So you need to look at the question in terms of practicality. And finally, and this probably is the most important one, can the question be formulated in terms of measurable outcomes that either support or disprove a particular hypothesis? This is not to say that in the area of health services research and program evaluation, that it's fine to do exploratory research without a particular question or a prediction. But it always helps, if you're analyzing data, to have a hypothesis in mind, one that can be evaluated in terms of measurable outcomes, like we saw with Project Match in terms of the percentage of days abstinent in a group of patients who receive 1 or 2 or 3 types of therapy. So here are some clinical research questions that have been formulated according to these guidelines. Is treatment effective? In that respect, you might want to compare a new treatment with no treatment if possible. Now, we'll be looking at that type of design in terms of the ethical problems involved in withholding treatment from people with alcohol and drug problems. But if you remember, we talked about the MTP project, where some patients were put on a waitlist control group. So for at least a certain period, you could evaluate a new treatment against no treatment. And that's pretty much an effectiveness question. Another type of question is, are some services more effective than others? So you can compare a standard treatment with a new treatment and see if it has a incremental effect over what's been observed in other research. And a third type of question, which is more exploratory, is what are the mediators and moderators of treatment effects? And that gets us into mechanisms of change. So are patient characteristics something that predicts outcomes? Do men differ than from women in terms of their outcomes with a particular type of therapy? Are older people more amenable to one type of treatment than another? Does ethnic group membership make a difference? All of these are questions about characteristics of the patients. But we could also look at the characteristics of therapists, or whether it's done in a group situation or a individual therapy situation, or the duration of the treatment. There are a variety of different questions that can be formulated around moderators and mediators of change. So to recap, here are some examples of focused versus unfocused questions. An unfocused question is something like, how are the harmful effects of tobacco use being addressed within minority populations? That's probably a good beginning question, but eventually you want to get it to the point where it's much more specific, and it's framed in terms perhaps of a hypothesis. Are quit rates in culturally adapted tobacco cessation programs better with Hispanic populations than with patients in programs that are not adapted to language and cultural needs? And you might predict that an adaptive program is going to be more effective if people are delivered a program appropriate to their language and culture.